Reminder, we have approximately 30 minutes, one question, one follow-up. Today we have Dr. Williams and Dr. Heyer here, so I'll turn it over to them to get started.
Good afternoon. As they noted, I'm pleased to be joined today by Dr. Dirk Heyer, COVID-19 Vaccine Distribution Task Force member and coordinator of the Provincial Outbreak Response approach. So I'm going to give some numbers and some updates as to what's happened in the week since Dr. Yaffe and I were here on Monday. And then Dr. Heyer can add any comments if he wishes, but to answer questions as well. And so with that, let's look at how we've done. And we're now day 6 going to day 7 of our first step. So we haven't seen yet the impact that might have happened if there has been some increased, I would say, less than adherence to the public health measures as we're going forward and waiting for vaccinations to be completed. But let's see how the data looks right now. Since Monday, we've reported an additional 1,050 cases. That's one of our lower ones reporting in our time period between Monday and Thursday. Let's see what those are. Tuesday, we had 296 cases. Then on Wednesday, we had 384 cases. And today, we have 370 cases. Ontario's 7-day average continues at a steady decline and is currently at 443. That's down from 617 a week ago, a considerable gain, and shows you the impact we're making as we let the vaccine work and build up immunity within our community, as we like to say the term. The 7-day provincial case rate also continues to decrease and is now down to 24.7 per 100,000 people. As you recall, we hope to get below 25 per 100,000 by the 14th. So we have moved past that. So I would say to Ontarians, well done. But we need to stay the course. Hospitalizations and intensive care unit. We continue to see improvement in the number of hospitalizations and ICU admissions. Today, there are 397 people in the hospital, of which there are 362 people in ICU. We do know, however, that 17 of these individuals in the ICU are Manitobans being cared for in our hospitals. This has been a service we've been more than happy to help them with as they've gone through their issue and are improving as we hear. So the number of Ontarians in ICU then is around 345. So we're hoping to see if we can get that number down to the low 300s, if not under 300, perhaps in the weeks ahead. As some saw in the media, it was a momentous occasion at the UHN Centre, Toronto General Hospital, where they celebrate they no longer have any COVID-19 patients in their medical surgical ICU. That's the first time they haven't had one since March of 2020, not 2021. So I'd like to thank you and to everyone in Toronto General for having cared for all these patients for these last 15 months. And I watched some of the celebratory activity on the media, and I could certainly celebrate with them as this was a change. But more importantly, I would like it to stay clear for the weeks ahead and months ahead as they start to recover and to start to have other types of patients in ICU that are pending, especially as we start to work on the surgical backlog and the elective, semi-elective, and as always, the urgent surgical cases. So thank all the healthcare workers. As we're seeing, we're giving them a reprieve in these numbers. Transfers are dropping, and the number of loads in their hospitals and the wards are decreasing to give everybody a well-deserved break. But the work is not at an end, as other regular hospital work has been in abeyance and needs to pick up and will be doing in the weeks ahead. In the deaths, and Dr. Heyer sitting next to me, and is always very concerned as I am that there's been another 32 since Monday. So this is again unfortunate, and we always express our sympathies to the family members because they are unique each time. And the fact is that we still have that in spite of our vaccination. We would like that number down. And of course, it's a delayed metric. and it doesn't follow as quickly as the others. So we are still concerned about that, and especially because we see some of the ones that are in that area and have passed away. Many of them, we understand, have not been fully vaccinated, and that was unfortunate. But we still want everybody to say, this is not over this yet. We still have to take this serious with our Delta moving and circulating. The testing, how are we doing? In terms of testing, 30,454 tests were processed a day. That still is a large volume in this time of decreasing number of cases, higher vaccination rates. And our positivity rate was down to 1.3%. We have not seen that since October the 2nd. And that's our important metric. While our volume's up, our testing percentage is down, positivity is down. So that's excellent. So positivity continues that way. We were 2.1% on a 7-day current average. That's down from 2.7 a week ago. And if we stay as we were going, we'll be down again next week. So in our testing, we're in our high volume and test numbers this week. We are coasting around the 300, upper 300 level. Perhaps over the weekend we may get down to the low 300. We might even dip below 200 again. But we still have to stay the course. We still have to do our stalwart work and following the public measures and waiting your turn to get your second dose of vaccine. And especially if you haven't got your first yet, please go out and get your first dose of vaccine and protect you and your family and your loved ones. With vaccines, we've had some technical briefings today, and that's been all excellent news. 11.9 million doses of COVID-19 vaccine have been administered, and over 2.3 million Ontarians have received both doses. Well done, and excellent work by the vaccine teams, the many ones, pharmacy, pop-up clinics, mass centers, primary care physicians, so many groups weighing in and doing things in many different ways. This is a fantastic job and a terrific thing that's being undertaken. This means 75% of adult Ontarians have had one dose. Again, well done, Ontario. And more than 19% are fully vaccinated with 2 doses. Now, they received 2 doses. They're vaccinated, but they're not yet immune. Remember, it takes 2 to 3 weeks, on average, to build up that immunity. Somewhat shorter in younger people, but on the average, we want to be sure that people have mounted immunity following their vaccination procedure. An average of 185,300 doses are being administered daily. Those are huge numbers. And a record of 210,611 vaccinations or shots were given yesterday alone. That's a lot of work by everybody, and thank you for coming out and for those coming forward. And just earlier today, we announced that over the next couple of weeks, more individuals will be eligible to book their second dose appointments. I know that eligibility has been expanding. People had some difficulties booking appointments, and there have been long lineups at many of the pop-up clinics. So while I'm encouraged with the enthusiasm of people coming out and getting vaccinations, I want to emphasize that because of the large volume of vaccines we are receiving, there is no panic to worry about that you won't get a second dose. We can assure you, you will get a second dose. I'm not talking about weeks or months off. I'm talking about a few days. If you didn't get a booking, be patient, try again. We want to make sure that we get your second dose to you as soon as possible. And as our volumes go up, we're increasing the supply out to all our sites, and we want to make sure that you get your second dose. And I think the people have waited in an orderly way, have been patient and booking, inquiring at their various authorities to assess how they might do that and to undertake to do that. We're making sure that you try and book at one site only if you can, especially if it's the one that you're familiar with, that you had your dose at the first time, if that's convenient to you. Booking multiple sites can cause some difficulties and challenges. And I know that's sometimes a tendency if you think you may not get a second dose. I can assure you with the volume of vaccines we are bringing in now, you will get your second dose. And I'm not talking a long way off. I'm talking days and maybe a week at the most. So we are confident of that, and we would like to make sure we get that to you in the right time, in the right way, in a system manner. Because besides giving the dose, it's very important to us in Ontario, from the get-go, we want an accurate, documented, correct record of your vaccination. Your first vaccination, your second vaccination. Who you are, when you got it, and which one you received. This is very important. At the time, it may not seem so, but for us, it is very important. And for you to have a documented official record is also important. So I'm pleased at how that's working. So our overall trends, we're heading in the right direction. We're moving along. We're not even 1 week through step 1. People are enjoying some of the extra activities that are happening there. They seem to be doing so in a contained and a consistent way. And that's important because I want to make sure that we see in the next few week or so, as we get to our 14 to 17 days out, are we starting to see an uptick in our cases? Our goal is we want to move steadily down. We do not want a fourth wave. That's the first priority. That's the vaccine program and the public health measures that allow the vaccine program to get caught up and move ahead of us on this, especially with the variant, the Delta, that's moving out and around. And now it seems to be picking up in some areas where there are unvaccinated clusters of people because it is highly transmissible. So those ones, you need to be careful. I would really encourage you to consider getting your vaccination. At the same time, we want to make sure that as we move forward and monitor the situation, our vaccine rates go up and we get that 2 to 3 week period after the dose to make sure we have immunity, not just vaccination procedure undertaken. So we continue to be cautious because the other thing we don't want to do is to open and then close again. We did that before and that was very perplexing to the public. It was perplexing to retailers, various service providers, and they have said again, if you're going to do this, please, if you're going to open, we'd like to stay open. And that's our goal. If we need to do it on a steady, cautious, and direct forward approach. And we're making that. You're seeing the numbers, you're seeing them come down, and that's a credit to everybody. So let's stay on the course, and let's do it. And I know we can achieve this. It's only a few weeks off. We're progressing, and we're doing a great job. You're doing a great job. Everyone in all the systems doing a fantastic job. And I know we can achieve this and bring this under control for a more return to normalcy as we head into the summer and into the fall. So with that, I'm going to hand over to the media for questions.
We'll go to the phone lines. Just a reminder, 1 question, 1 follow-up. Over to the first question, please.
Colin DeMello, CTV.
Hi, good afternoon, Dr. Williams. So it seems like tomorrow we could actually hit that 20% double vaccination target. I'm wondering if you feel like we still have to wait 2 weeks before moving into step 2 on the 2nd of July.
Well, thank you, Colin, and that helps me to reiterate our message. It's a surprise. I know people working at vaccination sites, some go in and get their shot and say, oh, I can go and party tomorrow. I'm not sure where they got that message from. Your system does not respond like that. It's not a magic shot all of a sudden. It does take your system, especially those over a certain age, 2 to 3 weeks to get the maximum benefit of the vaccination. It doesn't happen suddenly. Even young people, at the best, will take 5 to 7 days. Some may be longer because every system's different. So we want to make sure we have that adequately. So even though we may get 20%, therefore we'd like to see 2 weeks after that 20% to ensure, because that's 2 weeks, some are going to be 3 weeks, but they may have gotten earlier than yesterday or today. And so we want to assure that we have that protection because what we're trying to get is disruption of transmission. 1 dose of all the vaccines will protect you from severe consequences, but they can still carry it and you can still transmit it even with low symptoms or nearly asymptomatic. We want you with those 2 doses with as much protection as possible for your sake and for those you may come in contact in the future as we open up and we deal with a vaccinated population.
And Colin, good afternoon, it's Dirk Heyer. The other things to remember is that's one number. That's one factor and one consideration that Dr. Williams is talking about. There's also the number of cases, and as you know, we still reported 370 people were ill with a case today, and we have seen a progressive but still a continued higher number. We have the intensive care units. We have the case and contact management within the public health units to be able to stomp out any outbreaks when they come and be able to manage those, and then also the R factor. And I might be missing one of the other factors, but all of those things together are really important to consider. We have the Delta variant, which contributes to the R factor, and all of those factors need to be put together, and the opportunity to look to see if there's any challenges that arise with opening to some degree with step 1, and that might take a number of days before we see the impact of any potential changes. So I think all of those things are important to remember when we think about the next steps that everybody wants to move towards. There's no question we all want to do that, but we also do not want to put people's condition at risk with further health problems, especially serious ones, and also then have to face the potential of moving backwards in our steps.
Follow up?
Thank you. This is all about controlling the disease and not overburdening our healthcare system. So by mid-July, as an example, we're going to have a lot of vaccines and a lot of people who have received an adequate level of protection. So what about step 3 then? Does it need to be all the way, in late July, or can that be moved up by a significant amount, by perhaps a week or 2, because, we would have seen all the pandemic indicators move in the correct direction?
Well, our projections in there, as I said, when we wanted to go into step 1, as Dr. Heyer has importantly added the other metrics we're looking at, I had said I'd hope we would be under that 25 per 100,000. We have just moved under that now. We did open up a few days before that, but fortunately we continued to move down. We have not moved down way below that. We still have 370. We're up in the mid 300s there, and we'll probably be in that range again for tomorrow. We may, with low volume testing, drop down, and that's a bit of an encouragement, but it's not a true metric. It depends on the volume of testing. Our ICUs are still in the upper 300, mid 300s, Manitoba clients permitting. Our R factor is not yet under 0.7. Some health units and areas are under, but not province-wide, so we want to get that one down with other metrics. We've been pretty steady on that as we're moving forward and progressively. For things to change, we'd have to all of a sudden precipitously move even quicker. We haven't seen that demonstrated yet. As I've been recommending, we've said I'm forecasting we would be at these numbers, and we're pretty well right on. Because we're dealing with large populations and systems and processes that have to go forward. We still have the concern with the Delta and some outbreaks. As you know, we're dealing with some concerns in both the Porcupine area, the James Bay coast with some of our communities, and Waterloo, as we find pockets of areas within Ontario where they may not have had 2-dose vaccinations up to speed. There may be some groups and sectors in some areas where it may be under-vaccinated. So we're moving as fast as we can to assist those areas. But we have a number of parts of Ontario that for a while have not had a lot of activity, and therefore they have not experienced the Delta virus itself. And so we want to be cautious as we go forward. So I would like to think that all of a sudden things will change drastically, but these things tend to move on a fairly direct line, and we're going to be looking to our modelers to see if there's anything different, and they concur most of the time with the direction, and things may change, but I'm always open to surprises to see if it all of a sudden dropped precipitously, but we have not seen that yet. But let's stay steady, let's stay sure, and at least we can see when we look at the map, there's an end to the journey in sight. And let's make sure we get there safely rather than doing something careless or reckless along the way. So we want to make sure we're careful as we go forward.
Next question.
Matthew Bingley, Global News.
Hi, Dr. Williams. Just to follow up on that, is it fair to say that with, even the Premier was musing today about asking you about speeding up the process. If he was to ask you that tomorrow, would you tell him no?
I'm sure the Premier probably will ask me in that, and I would say here's our numbers, just like I've said today. These are numbers that are better than they were. They're still high, and we're still got a ways to come down. And the fact that before we'd say, well, they're concentrated in 2 or 3 areas, that's not true. They're all over. And we see Delta variants showing up in all our health units as we had some spread throughout the whole province, and that's where we get the cluster up in Timmins area and Porcupine. Other areas can form a cluster pretty fast. So we have to be cautious because while the numbers are down today, if we get these major bursts in 4 or 5 areas, we'll be back up over 400 to 500 cases. And if they're under-vaccinated or non-vaccinated, then we'll probably get an inflow back into our hospitals and into our ICUs. We do not want that. We don't want to even give the 4th wave a chance to get a foothold. And I know the Premier definitely doesn't want that. The Minister Elliott, does not want that. No one really wants that. So I will say let's stay the course. We haven't been in step 1 for a full week yet. We're only talking about another 14 days off. Let's see how we do. We got to do really a lot better. It's not that we're not doing well. We're doing great. We're on course. But we're going to have to move the yardsticks even further to get to step 2. And I'm confident if we stay what we're doing, if the vaccine rollout is going the way it is, we will get there as we predicted by the timelines we put forward. But people just have to be patient. I know you're eager. I know you want to get out. You want to do all those things. Some things we're doing already. There's more coming. But you don't want, like we don't want, to say it was open and now it's closed again. You'd be very frustrated. I would be frustrated. The Premier would be frustrated. No one wants that. So let's be moving stalwartly forward and not doubling back on ourselves in this process.
Follow-up?
Yeah, members of the Science Advisory Table have said that some of those activities that are in Step 2, if they were done outdoors with people wearing masks, such as getting a haircut outside on a sidewalk or getting a manicure, they would be okay with that at this point. Is there at all a possibility to sort of split the difference to try to keep cases down and also the business community happy?
Well, I think, our emphasis in step 1 is to do as much outdoor as possible. And with distancing, it still is difficult to do those services from 3 feet away or 4 feet away. So there is still a compromise in that situation. The other factor is that maybe some can do that, but in order to make it equitable, we want to make it that they all, if we're going to open them up, they all have to open up. And some may be able to do that. Others say that's unfair. We can't. And it would seem to be less than reasonable and equitable. So it's a thought in there, but we have to serve the whole wide sector. And there's not just those. If we're doing personal care settings, there's a large number that would say if they can, why can't we? And none of them have invested in infrastructure such that they could open up safely in step 2. And so we want to make sure that we would reward them with that investment, that they would open up and stay open. So we'll hear what suggestions are from that. We haven't heard anything directly from the Public Health Ontario or Science Table in any particular regard. But I agree with the point. Outdoor is safer, but we would not make that as far as our step process because it has to be deemed to be province-wide, all settings, equitable and fair and safe.
Next question.
John McGrath, TVO.
Good afternoon, Dr. Williams. I realize some of my colleagues have gotten at this topic as well, but I did sort of just want to ask, are you willing to consider even a small advancement of the reopening? And I'm thinking in particular in the context of Canada Day, going into step 2 on July 30th on June 30th instead of July 2nd would not be a huge change in the schedule, but in the same way that entering step 1 before the weekend I think was better for a lot of people's mental health. I'm wondering if that's the kind of thing that you might consider, even if, as I'm taking from your words today, you're not really enthusiastic about moving up 7 days, for example.
Well, as you know, we did move from the 14th back to the 11th. The data was moving adequately there. Is it something a day or two delay or a day or two early? Is that something, if our data really was positive, we could consider that? Canada Day, to me, is celebrating Canada, our natural environment, outdoors. It tends to be more of an outdoor type activity thing. I think there's many ways to do it. I wouldn't get too close to any sort of fireworks displays and things. So you got to keep doing the distancing. I think there's many ways to celebrate Canada Day within the step 1 context. I think more people are interested in a wider variety of services in there. So is it something that we could look at a day or two either way? That is possible, but we'll have to see what the data shows. And as I said, right now it's been pretty straight online, but we will analyze it as we get closer. But we've got another 14 days off in that, so let's see.
Follow-up.
You mentioned, and I think it's obvious in the data that the highest risk for people with the Delta variant or any other form of COVID is among the entirely unvaccinated. there's still substantial protection even with one first dose. That being the case, is there any policy or anything we're considering, maybe like reserving a certain amount of the supply in coming weeks specifically for first doses, and maybe pumping the brakes a little bit on the second dose rollout?
Well, thanks for that question, John, and nice to talk to you again today. So I think a couple of important things to think about vaccine and the Delta variant. What we know is, as Dr. Williams talked about, the symptomatic infection, so protection from symptomatic infection with the Delta, the information that we have fairly early, but seems from the UK, is that there's about a 30% protection from symptomatic infection for both Pfizer, Moderna, and AstraZeneca. And then with a second dose, the protection goes up significantly and provides very good protection from symptomatic infection. What we do also know, though, that the first dose of all of the vaccines does provide protection against hospitalization from serious illness. So absolutely, we want to continue what we've been doing, which is maximizing the first dose for all people across Ontario. We're at 75%. We want to keep going, and so that is always and continues to be a focus for all the public health units, all of the delivery providers of vaccine throughout the province, with increasing supply that's coming as soon as later this week. There will be a significantly greater number of appointments and availability to get that vaccine in a variety of different channels, which will open up again for more first dose as well as second dose delivery.
Last question.
Rob Ferguson, Toronto Star.
Hello, doctors. Just maybe for Dr. Williams, I guess this would be, with the 3 new health units being named Delta hotspots today, those being Durham, Hamilton, and Simcoe, Muskoka, I'm just wondering if you can provide some level of detail on what's happening in those health units and where to make them hotspots.
Well, I can start off, and I'll have Dr. Heyer answer that one, because those are hotspots in our concepts of vaccine program delivery in there. So it's a vaccination concept. So we're looking at where what the current rates of vaccination are. Supply matters. Looking at the rates of infection that are occurring. Looking at which are in the different age categories where they are in their compared to the provincial average of the different age groups, over 80, over 70, 60, etc. The youth one there, and to see if there's some aspects or hints of some increase in concerns around some of the FSAs we talk about, and how we might want to help them and encourage them to go after areas where there has been seemingly under vaccination, and to go at that and see if we can circumvent any increase, especially of the Delta. But I'm going to ask Dr. Heyer if he wants to comment further on that.
Yeah, thanks, Dr. Williams. The focus on these 10 public health units arises from where we have seen increased incidence of Delta within the province, and those 10 public health units are all areas where there's been increased incidence, some with much more. As you heard from Dr. Williams, Waterloo, for example, a significantly greater proportion of their infections and continuing to have rise in infections from the Delta variant, and so Waterloo being an example of significance. The other 3 that were added today, as in the Delta hotspots, were not as significant, but they certainly do have increased Delta prevalence, and that comes from Public Health Ontario through the testing results and the information, and in collaboration with the Science Advisory Table, these areas were identified and recognized, and provides an earlier opportunity in those locations to get the second doses as well as first doses to provide the best protection from the Delta variant. So it's a little bit different than what we used in the initial description of hotspots. This is, in fact, the presence of an increased instance of Delta variant, and we're watching that on a daily basis to decide if there should be additional allocations or opportunity to speed forward the eligibility for second doses.
Follow up, and this is the last question.
Yes. How close would Waterloo? Apparently, there's talk in Waterloo region that they may have to pull back a bit from step 1, or maybe not go into step 2 with the rest of the province. Where are they on that scale, and when do you think the call needs to be made?
So we as in both myself and Dr. Moore are in constant communication, as other members of our team, with the Medical Officer of Health, Dr. Shuli, and her team there, as we assist in many different ways. And part of that is giving some advice and direction, much like we did with in the Timmins Porcupine area. The local medical officer of health, if there's concerns to constrain any ongoing transmission of the Delta in those settings in different communities, can put in under the ROA legislation some things to limit some of the activities, either in step 1 or even further to, if there was still some concerns in 2 weeks from now, to limit some progression to step 2. We're hoping that, of course, they might be able to bring that down fairly assertively in the next week or so. So we are putting all our energy into helping them do that. They're doing a fantastic job, and they're consulting with their local municipal leadership, as is the public health unit with the board. And they are considering that they might put some limitations on congregate activities where they're concerned that there might be a potential for more spread of the Delta variant at this time. So we will continue to give them assistance on that, and to see whatever the local medical officer of health needs to do to bring things under control as soon as possible, and to move themselves from being a high risk, much like we've seen in some other areas, down to very low numbers. And so that would be very important at this time, and so we're helping them whenever way we can.
Thanks, everyone.